healthcare costs have gone through the roof lately. So what are you doing differently that's really helping the average person get healthcare?
I'm one of the very few wholesale medication clinics in Florida. We don't make a dime on medications. So we pass that cost straight on to our customers, making therapies that typically cost hundreds of dollars, simply the same price as the cell phone plan each month.
So many people are frustrated with healthcare costs right now, but there are some solutions. I'm here today with disruptor Dan Hughes from Coastal Primary Care and Wellness that is going to talk to us about getting access to healthcare and making it more affordable. Welcome, Dan. How are you doing today?
Thank you. Good. Thanks for having me.
So one thing I wanted to cover before we get too far into your journey is you were a Marine. Like, how did you go from being a Marine to pushing for healthcare and trying to fix, some systemic problems in our system?
Yeah, I was a vet going through the VA. I kept getting bounced around and, none of the appointments were adding up to solutions. And so I had to go find my own. And that led to me opening up my own clinic to help other vets that I'm able to do now.
That's excellent. Let's talk some numbers. What do doctors' offices or pharmacies actually pay for these medications versus what they're charging their clients? What's that spread?
Literally had a conversation with a patient yesterday. She's coming to me from another practice similar to mine. She's on weight loss, and she paid $1,200 for a 3 milliliter vial of tirzepatide. And this gets into the weeds a little bit, but her concentration was 10 milligrams per milliliter. She paid $1,200 for this 3 milliliter vial. I said, let me still tell you what my price is. So I pulled up, and because we are wholesale, that means that what I pay from the compounding pharmacies is what my patients pay. I don't make a dollar on any of this. So I have a typical tirzepatide can be 17 milligrams per milliliter, so almost double the concentration, which means that she could almost divide her dose in half and get twice the life out of this vial. I'm forcing us to do math right now. So anyways, my vial was $190, and it will double the life of her current vial with how many doses that she'll get out of it. And she paid $1,200.
So you took her from $1,200 to $190. Really, it's $80 because it's double the amount. So essentially you took her from $1,200 to $80 just by treating her with wholesale. That's quite a margin.
The margins are insane. The industry standard for medications that are coming out of compounding pharmacies are between 3X and 6X what the clinics are paying for. And you don't know any better because everyone's doing these markups. So, I meet clinics all the time and I scan their QR codes and they're charging guys $100 a week for a shot of testosterone. Well, this vial of testosterone that will last a man up to 10 weeks, if not much more, depending on their dose, is $40. The vial is $40. So what are we doing charging guys $100 an injection? And when I have a husband and wife come to me and they're like, oh, we just left a popular clinic in South Tampa and we spent $1,700 for 3 months of hormones for him and his wife. She's going through perimenopause. I said, that's kind of hard to believe because I can get your wife 6 months of perimenopause hormones and it's going to run me about $90. So what'd you buy?
That's
insane. They can't answer. They don't know. They're more, it's the folks that are already on these therapies that understand the markups that they're experiencing, they're easy. That's the folks that are hopping over as fast as they can. It's on the patient education side of getting people that when we do the labs, and that's another conversation, but when we do the labs and we identify that they do need some type of therapy, whether it's perimenopause, menopause, guys we're aging, our testosterone drops naturally, doesn't have to be a veteran from combat or anything. It just happens to all of us. And when we identify that, then it's, presented to them, hey, you're getting a heck of an opportunity here because not only do you get the therapy, but you're also getting a primary care provider on call for you for anything that you need. And that's what separates us from Hone. That's what separates us from a lot of the major players in this arena is guys are like, well, I pay, $150 a month for my Hone, $149 or $125. I'm like, yeah, but what else does that get you outside of your testosterone? Can you call them when you have a sinus infection? Are they there for you if you have a rash or a UTI or anything, And that's where they're like, I can call you for anything. I'm like, yeah, brother, anything, hit me up. Like, you get my cell phone, you get my provider's cell phones, text or call for anything you need.
So, you know, all business owners, myself included, usually put markup on things just to pay and to make profit. You've got kind of a different approach. Your profit center isn't the medication. Your profit center is just the monthly reoccurring subscription fee, which is, you said, $150.
If you are on our all-inclusive plan, that includes if you are on the GLP-1, hormone replacement, thyroid support, advanced peptide therapies, general primary and urgent care, on-call for anything you need, it's $150 a month flat fee with no additional copays each time you reach out. You can reach out as much as you need to.
And is it like within standard business hours or standard business days?
It's, typically, 7 a.m. to 7 p.m.
Okay.
Monday through Friday. We're not emergency medicine. If you hit us up on the weekend or in the evenings, we'll probably let you know, hey, can we reach out to you? I can do this for you first thing Monday morning. Is that okay? Or if it's, if something more urgent, then yeah, we can easily hop on a call and guide them to a resource that can assist them right then and there if they need that.
And you don't deal with insurance, right? This is a straight cash pay. Somebody can come to you without any insurance coverage at all and still pay for these services to you, still get access to a doctor, still be able to get their prescriptions.
Exactly. So, most insurance plans aren't covering medical weight loss. They're not covering a lot of hormone replacement therapy. My phone rings every week, women that are telling me that they can't get hormone replacement therapy. They've asked their OB, they've asked their primary, they've asked everyone in their network, and it's always, either they can't get the labs covered or their OB will just give them a estrogen patch without even doing labs. And, it's kind of like slinging paint at the wall. When they come to us, we're able to get them the therapy at an affordable rate that's accessible for everybody, especially for the weight loss, because our underserved communities have the highest comorbidities, diabetes, of obesity, of hypertension, and they're priced out of this amazing solution that's nothing new. This medication has been around for almost 20 years. So if their insurance isn't covering it until it's too late, until they are diabetic, then the preventative side says, well, you have to pay $600 a month for your medical weight loss. That can't be the answer. Yeah. And the answer is we do wholesale medications and we make just a small amount of money each month on the membership plan, which is month to month. We're not locking patients into year-long contracts or anything like that. This is month to month. It's meant to be like a cell phone plan.
Can you tell me an example, quick story of somebody that you just really helped? You knocked it out of the park. They came to you for something and you found something, or any kind of cool story that you might have that's a real success story.
Yeah. There's honestly so many. Like, every patient's a success story that's ongoing. I had a husband and wife come to me. They were going to a fancy functional medicine clinic to get their labs done. They're business owners. They don't have health insurance themselves. And so this clinic was going to charge them $350 for their lab and then another $350 to review the labs with them. So for the two of them was $1,400 to get labs done. And I was like, well, send me that lab panel. So they sent it to me. Our lab panel, proud to say, had more labs or more panels that we were looking at. I saved them $1,100. So my cash pay, I went to war with lab companies. 8 months, had 3 lab reps quit, transition, drop my account to get my prices where I needed them to be. So when you think of fancy labs, custom lab panels, if you're looking at the whole set, your primary care provider is saying, no, we don't test hormones, we don't test thyroid, we can't get those covered. I get those covered. And for a cash pay patient that doesn't have insurance, a female who has a larger panel, her panel is $131. If she were to have insurance, that panel is about $3,200 to $3,500.
Wow. Dan, you have a strong call to veterans and first responders. Seems to be a community you really resonate with, understandably, for veterans. But what made you want to really help that community? What made it so important for you?
I mean, honestly, it's just, I feel like I have a bond with them. I felt that when I was doing the military orthopedic med device sales. It was my way of kind of giving back to veterans, and this is still part of that in a sense. I've experienced firsthand, how the VA is amazing. I don't ever mean to make the VA sound like they're not doing their part. They're doing an amazing thing, but they're so overwhelmed and that there's gaps. There's always going to be gaps in something big like that. And so for my clinic to be able to fill the gaps for the first responders, for the military retirees, and we're offering the discounts. If you are current active duty first responder or military, if you're retired first responder or military, if your spouse is, everybody gets discounts to their monthly memberships for that's a way of recognizing their service. But ultimately, these folks have the highest rate of sleep apnea, of hormone deficiency imbalance, all because of disrupted sleep cycles, pressure of the job. If we're working night shifts for 6 months, it's going to affect things, right? Like, it doesn't matter how strong you are, how tough you are. And for them to have an easy resource is pick up the phone and say, hey, I want to check. First step one is let's check. Let's just see what it is. And then if it is what we think it is, then yeah, I have an easy solution and we'll get you on, and it's not going to cost you $500 a month.
And so while you have a specialty in veterans and first responders, your program's open to anybody. Is that correct?
Anybody in the state of Florida, Georgia, or North Carolina, currently expanding into more states later this year. But right now, so I've got patients that originated here in Tampa. I met them at networking events. They come on board. We start a female on hormone replacement therapy who's in mid 40s or early 50s. Next thing I know, she's calling her sister in Jacksonville, and she's calling her mother in Pensacola. And now I got, the rest of the family on board in the state of Florida. And what's great about it is, we treat them, and then the pharmacies are shipping these medications straight to these patients' front doors.
So what would you say the resistance is between you and a regular doctor's office? Because, some people say, oh, I've got to go see the doctor, but you really don't have to physically see the doctor for too much, except for like emergency medicine. But if you have a minor headache or a doctor needs to review lab work, they don't have to do that in person, right? You do everything virtually.
Much of primary care can be done virtually. Now, there are certain limitations to that, and we respect that. And, what's listed on our website is many of the most common things that people will come to us that we're able to handle. But yeah, I would say a very large portion of primary care and urgent care can be done by simply doing the lab work, diagnosing based on symptoms and labs. So many of our patients are coming from brick and mortar primary care providers, and they're being told, well, you look fine. So you're good. Drink more water, drink less wine. I had a patient the other day told me, my provider told me I should just drink less wine. That's my problem. We looked at her labs, and her labs only had like 3 panels run where she was missing all her thyroid, she was missing all her hormones. We had no picture for what was really causing the imbalance that she was experiencing. But her provider's like, no, you look fine, you're healthy, all your other numbers are normal, so you're good. And that's where we step in is, in functional medicine, it's all about root cause analysis, and it's treating based on symptoms and lab values, not just going off the labs alone.
So what's been the biggest challenge? I'm sure the industry is kind of pushing back. They don't want to describe all their prices. They don't want people to know their markups 3 to 10x. So what kind of challenges have you faced there? Have you had any?
So I would say my 2 biggest challenges are on the patient side. Is this real? Is getting to build that trust with them, and they quickly come around when they have that first initial consult. They talk to this provider. Providers, every appointment is a minimum of 20 minutes. Every patient gets 20 to 45 minutes appointments with their provider for anything that they need. So there's plenty of time to get to know each other, to start to build that relationship that we have ongoing with them. But when people just see like our ads on social media, they're like, that's not real. And then I'm like, no, actually it is. Like there's no like bait and switch. This is it. That being said, because I'm not breaking in huge margins, I also don't have a huge advertising budget. So getting the word out is like my biggest challenge right now. And I talk to marketing firms and they want 50 grand a month for ad spend, or the lowest I could find was 10 grand a month for ad spend, where I wasn't going to get a JV marketing manager in the mailroom that managed 60 other clients just like me. If I was going to get an actual marketing firm to do ads where I was going to get real attention, our ads were going to get real value, you got to spend, 20 grand a month. So if you're not making markups on labs, if you're not marking up medications, then where do you pull that money? And so our biggest challenge is getting the word out.
Yeah. So sounds like a word of mouth campaign is definitely what could help here. So before COVID, we could never imagine being across the world and having video calls. And now I think that's probably assuaged people from their fear of only meeting a doctor virtually. That was, massive change years ago. Where do you see the healthcare industry going next? Do you see the continued trend in telemedicine? Do you see other trends coming up?
Actually, it's interesting you brought that up. So a lot of the states now are switching to pre-COVID laws and policy for telehealth, which makes it more challenging for telehealth providers, especially on controlled substances side. And so, in the last few years, many states have been like, well, next year we're going to implement where it must be in-person visitations, X amount of times a year, or the first consultation has to be an in-person consultation in order to prescribe types of controlled substances. And, when we talk about controlled substances and where we were falling in, I'm discussing testosterone, for men and women. So that makes it more challenging for clinics or providers that are specialized in hormone replacement. Is the COVID really helped with changing the policies to favor telehealth. And now we're starting to see that they're going back to pre-COVID. So it'll be interesting to how that turns out in the end.
You mentioned earlier about a 45-minute consult, right? So your very first consult's free? Like, how does somebody take advantage of that?
So we ask people to either check out our website, coastalprimarycare.com, and there they'll see it'll filter or funnel them to scheduling that free consult where they can make it about medical weight loss, general primary care, hormone replacement therapy. That consult's 45 minutes where we really want to get to know them, their goals, what they've tried, what worked, what hasn't worked. And then from there, most likely we're going to order the labs. We're big on labs. We'll get the lab results back, and then we schedule another 45-minute lab review. Few people have ever had just 45 minutes education about labs. And so, it's usually, oh yeah, you're within the range, move on to the next, let's hit. But we're looking at where are we at in this range? Are we at the low lateral limit, upper lateral limit? And doing a lot of education. People think, I quit eating all the fun foods because my cholesterol just keeps going up. Well, did you know that's your good cholesterol number? Yeah. We have these conversations all the time. My primary care provider told me that I need to drink less because my liver enzyme, my liver lab panel was up. Well, actually, there's 2 liver panels, and one will increase if you worked out really hard the night before or if you are dealing with a bone fracture. So let me ask, did you hit leg day before you did labs? How did you know that? Because your alcohol liver number is the other panel.
Got it. So providing education is a key component of providing good healthcare.
And when we provide the education aspect, patients start to develop that relationship, and they're like, hey, let me see if they can help me with this. Let me see if they can help me with that. We'll talk to a patient 4 times in a week. It's still that flat monthly fee.
That's awesome. Dan, thank you so much for being here today. Dan Hughes is trying to do something different with healthcare. If you want to reach out and connect and hear about his amazing programs, look at the comments. We're putting his links and contact information below.